Today, we are diving deep into hypertension. What exactly is a hypertension? Hypertension can be a silent killer. It may lead to heart attacks, strokes, kidney disease, and even vision loss. So how is hypertension diagnosed? If your systolic blood pressure, the top number, is 130 to 139, or your diastolic pressure, the bottom number, is 80 to 89, you might be in the hypertension range. Doctors usually need multiple readings over time to confirm a diagnosis of hypertension. Let's talk about how the blood pressure is measured. Firstly, there's the automated office blood pressure monitoring, AOBPM. The doctors use a device programmed to take multiple readings after you've been seated and rested. The readings are generally more consistent as human errors are minimized. But these devices can be pricey, and not all clinics might have them. Then there's standardized office blood pressure. This traditional method involves a cuff, a pump, and a doctor or a nurse interpreting the readings. Nearly every clinic can do it. However, it's prone to inconsistencies. A little chat during the reading can alter the numbers. Moving out of the doctor's office, we have self-measured blood pressure or home monitoring. Modern devices even store your readings or take measurements while you sleep. And then there's 24-hour ambulatory blood pressure monitoring. It tracks your blood pressure throughout the day, capturing fluctuations that typical method might miss. What exactly should you expect after newly being diagnosed with high blood pressure? Your doctor will look for end organ damage. This includes checking your heart for possible enlargement, examining the vessels in your eyes for changes, and assessing your kidney function through blood tests and urinalysis. They measure key elements such as potassium and sodium levels, along with complete cholesterol profile. Additionally, your doctor will use a urinalysis to detect any kidney issues that could be contributing to your hypertension. Your heart's electrical activity gets scrutinized through an electrocardiogram, commonly known as EKG or ECG. At times, an echocardiogram may be also used to provide a visual of your heart's structure and function. Beyond these tests, doctors also evaluate your lifestyle. This includes your diet, which can directly affect your blood pressure, physical activity level, alcohol consumption, and even stress factors. Increasing your physical activity is the first stride you can take. Aiming for at least 150 minutes of moderate intensity aerobic exercise per week not only lowers the blood pressure but also strengthens heart health. Adopting a heart-healthy diet like DASH diet is highly recommended. Weight management is another key factor. Small reduction in weight can have a considerable impact on your blood pressure levels. Limiting your alcohol consumption and steering clear of tobacco use are vital steps in your journey to maintain a healthy blood pressure range. Lastly, managing stress is an important aspect of hypertension care. When lifestyle changes like diet and exercise fall short in controlling high blood pressure, medications play an essential role. Each class of drugs has its mechanism of action, benefits, and potential drawbacks. Diuretics, commonly known as a water pill, increase the urine production, helping to eliminate the excess sodium and water from the body. They are often chosen as a first-line treatment and are especially beneficial for those who retain fluid. Next, AC inhibitors, which hinder the production of angiotensin II, can sometimes cause a persistent dry cough. ARBs block receptors for angiotensin II and are less likely to cause this side effect. Calcium channel blockers prevent calcium from entering the cells of your heart and blood vessel walls, relaxing the vessels. They're useful for people with asthma and are less likely to impact cholesterol levels. Beta blockers slow your heartbeat and reduce its strength, easing the workload on your heart. They might not be the best choice for people with asthma or diabetes, as they can mask symptoms of low blood sugar. When you're facing hypertension, you need the right tools and network. That's where technology and community resources come into play. Smartphone apps are invaluable in tracking blood pressure trends over time, sending you reminders for medication, and even connecting you to healthcare provider directly. Wearable tech like fitness trackers and smartwatches do more than count steps. They can keep an eye on your heart rate and, in some cases, even give blood pressure estimates. Telehealth services have taken a giant leap forward, allowing for remote consultations with your doctors, which can be especially helpful for routine checkups and managing your treatment plan. Let's not forget the incredible value of community resources. They provide support networks via online forums and local support groups where you can share experiences with others who understand what you are going through. Remember, while this video gives you a starting point, it's not a substitute for medical advice from your primary care provider. You should get in touch with your primary care team to discuss your results further. Thank you for watching, and please take good care of your health.